Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, everybody. I am Professor Dr. Mohamed Ayman from Alexandria University Echo-lab. This is a joint workshop with Prince Sultan Cardiac Center in Ihsa from the Kingdom of Saudi Arabia. I have the honor to work with my dear colleague, consultant Dr. Hani Mahmoud. He is an eminent echocardiographer in 3D echo. I am very pleased to have him with us in Cardio Alex. He is going to give us a talk about how to do a 3D trans-thoracic echo step-by-step approach. Dr. Hani, yes.
Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, everybody. It's my pleasure and honor to be here and share some sessions in Cardio Alex, which is one of the mega events in the region. Upon the kind invitation of Dr. Mohamed Ayman Abdelhay, the consultant of Echocardiography in Alexandria University, we are going to present a case of step-by-step approach of trans-thoracic three-dimensional echo exam. I hope everybody will enjoy it. I hope it will be beneficial for everybody who's interested in 3D.
Thank you.
Thank you. Bismillah ar-Rahman ar-Rahim. This time we are going to do a 3D trans-thoracic exam. We will go through the controls of the machine, how to acquire the image and how to orient the image, how to do cropping, and how to use the different modalities on the machine like X-plane, live 3D, 3D zoom, or full volume. This case has rheumatic heart disease, mitral stenosis, and severe MR. Before going through the diagnosis, we will go first to see the modes of acquisition. As you can see here, this is a 2D image, parasternal long axis view. I have here many options. I have the live 3D, I have the X-plane, full volume, and 3D zoom. X-plane is not a 3D view, but again, you will not be able to get the X-plane except by 3D trans-thoracic probe. If I click X-plane, it will give me two orthogonal views. My reference image is on the left hand, the same image I started with, and on the right hand I have the short axis view. This is the elevation plane. By moving the X-plane line from side to side, I can see the image on the right side. The short axis view is changing. If I come to the ostium of the mitral valve, I can see here a short axis view of the mitral valve at the orifice, and here at the annulus, and here on the left atrial level, down to the left ventricle, and to the apex. This is by using the X-plane. This is a very good chance to make sure that you are exactly at the tip of the mitral valve, that you will not have if you are using only 2D. Back to 2D, there is a 3D, live 3D. As you can see, this volume is live, 1 beat acquisition, not 3 beat, this will be cut. This is 1 beat acquisition, means this is live. This is what's happening at the moment, but it is narrow sector. If I moved, I rotated the image, you can see it is narrow sector acquisition. This is the depth or elevation width. It is narrow, but it is live because it is 1 beat acquisition. Frame rate here is 17 volumes per second, 17 hertz. Because it's narrow, I preserve the frame rate, I can get a high frame rate. If I increase the width from these buttons, this is lateral width and this is the elevation width. I can change them by just clicking lateral and elevation. This is the lateral width. If I increase the lateral width, as you can see, by just rolling this knob, the frame rate decreased from 17 to 11. If I decrease the sector, again, the frame rate will get higher because I'm asking the machine now to give me smaller sector. So this is live 3D. It's live, but narrow sector acquisition with reasonable frame rate because it is a narrow sector acquisition. Back to the 2D, I have the 3D zoom. By clicking 3D zoom like in 2D zoom, it will give you a box first. You will optimize the box, then you will acquire, it will give you the zoom structure. In the left-handed side, this is my reference image. The box here, I can control the box position up and down. As you can see, the box position is changing on the left and right side simultaneously. And I can control the size of the box. The depth is also changing on both sides, but the width is not. The width is only changing on the left hand side, and it is fixed on the right hand side. On the right hand side, I can change the width on the right hand by choosing the elevation width, like that. Then acquire 3D zoom again. It will give you a zoomed volume with the same orientation of the 2D. From the 2D, I know that here it was the left atrium, and here's the mitral valve, here's the LV. This volume has the same orientation. That means the mitral valve ostium is facing like that, and here is the left atrium. If I need to look at the mitral valve on FASE view from the left ventricular perspective, I have to rotate the image that way. This brown color is the blood intensities, so I have to decrease the gain a little bit to get a view of the ostium of the mitral valve from the LV perspective, and I can magnify to see it more clear. As you can, this is the ostium of the mitral valve on FASE view. You can acquire this to do your analysis for multiplannar deformation to get the ostial dimensions of the orifice. If I rotated this volume 180 degrees, now I'm looking to the mitral valve from the left atrial perspective. .3D zoom mode is live again, and it has a reasonable frame rate because usually it's a small sector, but again, if you increase the size of the request sector, the frame rate will get less. If you narrow the sector as much as you can to the region of interest, you will preserve the frame rate. The last mode of acquisition is full volume. If I click full volume, by default the machine is taking that over 4 beats, as you can see. And if you noticed on the screen, if we decrease the number of beats to 2, the sector is divided into 2 sectors only. If I increased it to 4 or 6, as you can see, 1, 2, 3, 4, it divides the volume that you ask for over the number of beats. So for example, if you ask the machine to give you this volume over 4 beats, it will say okay, it will divide this requested volume over 4 beats. The first beat will go for the first sector, the second for the second, third for the third, and so on, and then the machine will stitch these volumes together for you. That has an advantage of having a high frame rate. You can get this full volume for the heart with a reasonable frame rate of 18. But the drawback of that is what's called stitch artifacts. These segments are not taken on the same cycle, 4 different cycles. That means if the patient took a deep breath, or if the rhythm is irregular, or if I myself moved my probe, these segments will not be harmonic with each other. So you will see some demarcation lines in the image, which is called stitch artifacts. I'll acquire that. Okay. Now these are the modes of acquisition. Let's go to valve by valve. We'll start by the mitral valve, which is considered the son of the 3D because it's a typical valve for 3D acquisition because it is thick, relatively slower motion valve, and especially if the patient has rheumatic heart disease, for example, that's why we chose this case. Thickening of the valve or of the structure will give it more visibility in 3D at this stage, at least, of development of the 3D, because till now frame rate is less. Spatial and temporal resolution of 3D is still low compared to 2D. That's why we need thick structures to be very well visualized by 3D. The mitral valve, I can start by the Barcelona long axis view. I can take this by live 3D mode. It will give me the same view as the 2D, but with depth, with some elevation depth back on the back side of this frame. As you can see, the rotations of this image can the controls of this image is different. You can see 3 different controls are down. I can switch between them by just clicking this button. 3D rotate means I will change the rotation of the whole sector, but it is the same sector. I'm just rotating up and down and right to left like that. And there is elevation position and there is lateral position. Lateral position means I will image another sector. I'm sweeping but keeping the probe in the same position. I'm just lateral position imaging lateral and medial to the reference volume that I started with. Still, this is live. And there is what's called elevation position. If I move the ball while I'm in elevation position, it will go back and forth. Now I'm going back. Now I'm going more anterior, as you can see. So I have 3D rotation of the whole image. I have position, and I have also what's called width from here. Lateral width and elevation width. If I click lateral width, I can control the width to make it more narrower or larger, provided that I have to look at the frame rate. Because the larger sector, as we said, lower frame rate you will have. So again, for the mitral valve, I can take this by live 3D, then lateral position, I'll just come near, close to the orifice, then by 3D rotate the image to make it on fast view, and then I can enlarge the elevation width, like that. Now I'm having on fast view of the mitral valve from the left ventricular perspective, and decreasing the gain will get rid of the blood intensities, as you can see. Acquire that. Also, we can get the mitral valve from the apical view, that we will come to it later. There is a statement first everybody has to know. If the resolution of the 2D is poor, don't try to go for 3D, because it is gonna be worse. Because of the lower frame rate and lower spatial and temporal resolution of the 3D, the question for 3D shouldn't come if the image is not clear by 2D. Go for 3D if you have a question about the anatomy or the morphology of a structure that is clear, but you don't understand its morphology and its complete anatomy. So if you have a good resolution by 2D, but you don't understand what is the anatomy or morphology exactly, then you can go for 3D. But if you have a bad resolution by 2D, don't go for 3D. That's why in this case, maybe the mitral valve is the best valve to look at. Apical for chamber view, I can see the mitral valve now. For sure thickening, I can go for 3D zoom. 3D zoom is usually optimal for the mitral valve because it's a relatively small structure and thick, as we said, so I can get it clearly by 3D zoom with a reasonable frame rate. I'm optimizing my box now. As you can see, the depth up and down to include the ostium of the mitral valve and some part inside the left atrium, and on the elevation plane also I have to include the whole annulus. Then I will acquire this 3D volume. This is live 3D zoom. Again, it has the same orientation as the 2D image. So the mitral valve is pointing up, and this is the left atrial side. So I know from that I need to rotate the image like that to see the mitral valve on fast view. Decreasing the gain a little bit will show me a very clear view for the mitral valve. This is on fast view of the mitral valve from the left ventricular perspective. The leaflets are thickened. This is the anterior mitral leaflet, and this is the posterior mitral leaflet, and here is the way to the LVOT. This is the LVOT, anterior mitral leaflet, posterior mitral leaflet. Rotating that volume will give me the left atrial perspective of the mitral valve. This is the aorta. Here is the anterior mitral leaflet, posterior mitral leaflet. If I need biatrial view, or for both valves, I can go for 3D zoom, enlarge the sector to include mitral and tricuspid, and also enlarge the elevation width from here, provided that resolution is good. And then 3D zoom again, rotate the image, decrease the gain a little bit Now we have a very clear view for the LV from inside, mitral valve, anterior leaflet, posterior leaflet, LVOT, and this is the crescentic shape of the RV. Here is the tricuspid valve. Because the tricuspid valve is thinner and faster in motion, it is not clear as the mitral valve. We will take now volume for LV quantification. First, optimize the depth. You don't need all of the heart if you are only concerned with the LV. Then full volume. Now the machine by default will go to 4 beats. My advice again to decrease the number of beats to 1 first while taking the full volume to make the optimization faster. From here you can change from 4 beats to 2 beats to 1 beat according to what you want. And then make sure that you are including the whole left ventricle. This is the reference image, and this is the orthogonal view or the elevation plane. Now you can increase the number of beats into 2 or 4. And then I will ask the patient to hold breath. This is very crucial to avoid stitch artifacts. خذي نفس طويل. طلعي نفس الآخر. اكتمي نفس بقى. ما تنفسيش لما خلاص نفس طبيعي. Why is that? I need the patient to fix her respiration to keep the heart in the same position. And my role is to fix my probe. I shouldn't move my hand at all in order to decrease the stitch artifact as much as I can. This is the volume I got. Once you ask the machine to show you the full volume, it will show you the full volume with a green plane, as you can see. That means this volume is cropped. Means it showed you the inner half of that volume. Then you can reset cropping to see the full volume. This is the shape, the real shape of the full volume, but the machine will show it to you, shattered in half to show you what was inside, and then you can work with that later on. Now we will try to take full volume with color for the mitral valve. Full volume, and then color. Again, decrease that 1 beat first, and then optimize your volume. As you can see, this part is the lateral plane and this is the elevation plane. They are not including the whole mitral annulus, so I need to increase the lateral width to make sure that I'm including the whole mitral annulus, and elevation width as well. Now I'm including the whole mitral annulus. I don't need all the depth, so I'll decrease the depth. Then I will increase the number of beats to make sure the frame rate is high. As you can see here, frame rate is only 2 because it's 1 beat acquisition. If I increase the number of beats, it will double. Now it became 4 because 2 beats, frame rate is 4. I can increase it more, 4 beats, so frame rate is 7. Again, because this is full volume, I will ask the patient to hold the breath. خذي نفس طويل. طلعي نفس الآخر.
If she is fibrillating, you prefer to set it to 7 or something, or 4 is enough?
And atrial fibrillation?
Yes, she is fibrillating. So.
If she is in atrial fibrillation, it will be difficult to increase the beats because once you increase the beats more, you will get more stitch artifacts. It's one of the major problems of the full volume is the atrial fibrillation, or in TE in elective patients. You will not be able to ask the patient to hold the breath. This is the volume that we imaged. Reset cropping. This is the picture of the mitral valve with color, with which you can do your analysis offline to calculate the vena contracta area and so on. A zoomed view for the mitral valve for the purpose of calculation of the mitral valve area. 3D zoom. This is the mitral valve, as we said. We acquire the volume, and then from that volume I can go for the Q-lab, 3DQ. Once I open the volume in the Q-lab, on cart or off cart, it depends on the Q-lab you have, it will be divided into 4 small screens or 4 small boxes. As you can see, one is green, represented by that button, green button, and one is red, one is blue, and one is 3D. This is the green box. It has 2 lines. It has red line and blue line. Each line is corresponding to the other box. So that means if I move the red line here, the image in the red box is changing, as you can see. If I move the blue line up and down, the image in the blue box is changing as well. So how to calculate the mitral valve area of the mitral valve for the mitral valve stenosis cases by 3D. In 2D, in the short axis view of the mitral valve, you cannot guarantee that you are exactly at the tips, because actually you are just imaging in one dimension. But here, although we are going back to 2D, but here it is oriented 2D. I know at what level I am putting my lines. That means first I have to choose the diastolic frame. This is the diastolic frame. Mitral valve is open. I can sweep between frames from here. So this is number 5, and I can also keep the image running like that. But I already know that frame 5 is the one I want, and then I will put my lines inside the opening of the mitral valve. Now I have 2 longitudinal views for the mitral valve. Then it comes now to the blue line, which is the short axis view. I put it at the ostium of the mitral valve. I can move the lines by 2 ways. Either to hold the line from the middle, it will be like a hand. That means I will move it from side to side only, like that. Or if I went to the periphery of the line, it will be a hand plus a curved arrow. That means I can do rotation. So I should put the lines, especially the blue line, at the ostium of the mitral valve in all the images, like here. The more the mitral valve will be stenotic and rheumatic, the more the opening, its opening will be planar, will be flat. The less stenosed mitral valve, it will not be that flat in order to have it into one plane of imaging. So here, if you look to the short axis view, the mitral valve from down, this is the blue box represented by this blue plane. I can also magnify. This is the ostium of the mitral valve. I can enlarge this by clicking the blue box alone. This is the area of the mitral valve. I can trace it. You can do this either on the machine or in the Q-lab station that is off card. That is much more accurate than doing this with 2D only. This patient still not have severe MS. Mitral valve area is good, although it is rheumatic, but it is not severe. If you click the MBR mode, it will be divided into 4 boxes. Click MBR mode again, it will give you the 3D volume itself.